Hi, I'm Gordon McInnis, and I work here at Carolina Beach Counseling in Carolina Beach, North Carolina, and like to talk to you today a little bit about how women deal with depression. Depression hits women about twice as much as it does men. Now, in my personal experience, I'm not 100% sure if it's really twice as much in women as it is men, is that it's maybe twice as much reported in women than it is men. I think socially it's a little easier for a woman to talk about being depressed than it is for a man to talk about being depressed. But the impact is the same on both men and women. Women, however, are able to, at least in our society, show their emotions a little bit more and have those emotions displayed out for other folks. So it really works about the same. I mean, it's we all have the same kind of brain. Our brains are made out of the same kind of chemicals. Women often, obviously have cycles that they go through and that kind of thing. So that can have an impact on women and their depression as well. And women also are more likely to go seek therapy and go seek help. But a lot of times, the first place they don't usually go and talk to a therapist first. They're going to go talk to their primary care physician. And the problem is that sometimes with depression, especially I find with women, is that anxiety kind of goes along with depression. Those anxious feelings, maybe even some panic, that kind of thing. And so when they go and talk to the doctor, a lot of times those are the symptoms that are more disturbing, are the anxiety symptoms. And so they go talk to the doctor, they tell them all about their anxiety symptoms and how they can't sleep and their mind's racing and their thoughts are racing. And so he puts them on an anti-anxiety medication and they don't get any better because it's not the right medication. And so it's important to really kind of look at what are the symptoms that you're actually feeling, and looking at those depression symptoms and actually going and talking to the doctor about that. Doctors are there to help. They're not there to judge. They're not there to say, oh, you're a bad person because you're depressed, or you did this wrong, or you did that wrong. If you don't tell the doctor what's really going on and leave things out, then the doctor can't make really good decisions for your health care. And that's what's important too. Now again, a lot of times people come and come and talk to a therapist, that kind of thing. And I like to work in coordination with either their primary care physician or a psychiatrist who has real specialized training in working with psychiatric issues. They're an MD, but they have the specialized training on top of it. I think sometimes in general practitioner offices, they're not necessarily really well versed in how to identify depression really well. So a lot of times they will make a referral to a counselor, or they'll make a referral to a psychiatrist to have them evaluated to see if we're really dealing with depression or if we're dealing with something else. That's some basic information. Make sure that you go and get some advice from a healthcare professional.